Hello and welcome. It's 11 a.m. here in Seoul. I'm Ji-young at the Arirang News Center. We're breaking into our regular programming to bring you the latest live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Yoon Tae-ho, the overall officer of disinfection at the Central Disaster Management Headquarters, will be briefing us on the coronavirus situation here in the country. The briefing will give us an update on the number of new infections as of midnight, as well as any trends and the latest on the vaccine rollout. Also, the latest social distancing measures and efforts that the government is making to contain the virus. To give you a brief idea as we wait, South Korea reported 794 new cases of COVID-19 on Wednesday. The briefing is about to start now, so let's take a listen.
Let us now begin our regular briefing for June 30th, Wednesday. As of today midnight, our domestic infections stands at 759 and 35 new imported cases have been reported. And we also had one additional fatality. I extend my deepest condolences to the deceased and the members of the bereaved family. Ladies and gentlemen, lately, centering around the metropolitan area, we are seeing a resurgence of the virus. And in the metropolitan area alone, we have had 631 cases yesterday, and this is about 83.1% of the total infections as of yesterday. And we also have had a large infection breaking out in the metropolitan area, and this is nearing the threshold of level 3. And centering around the university campuses and offices, as well as restaurants, which are all our venues of daily venues, we are also seeing a cluster infections. And moreover, the Delta variant is also spreading at a very fast pace. And also those above the age of 60, we are seeing a decrease in the infection, and they only account for less than 1% of the total latest infections. However, centering around the infections who are not vaccinated yet, especially those in their 20s and 30s, these young population, they are also seeing an increase in the proportion of infections. And thanks to a decrease in the number of infections among the senior citizens, we are seeing a decrease in the number of fatalities and critically ill patients, and our fatality rate has also decreased to 1.29%. And the medical response capacity here, right now we have a sufficient amount of the room available. And as for the ICU beds, we have over 600 beds available for immediate use. And also as for the hospital beds for light and moderate symptom patients, we also have about 67% hospital beds available right now. And this is also about 61%. And in the metropolitan area, we also have about 59% of these hospital beds available in the capital area. And as scheduled, we will be having our revamped social distancing scheme being effective starting from July 1st. And we believe that in the capital area, we will have level 2. However, if there is greater risks of infections in the metropolitan area, we will embark on a leveling, the upward leveling of the level of the social distancing. And to this end, we ask the young population to also take particular precautions. And as we are faced with increased risks of infection in the capital area, we ask you to also refrain from having large gatherings in indoor spaces, and also avoid any group meals and also group consumption of beverages together as well. And we also ask you to abide by the quarantine measures at all times, and especially you need to wear face masks at all times. And in order to intensify our bolstering of the quarantine measures, we have also discussed these means in our quarantine meeting yesterday. And to this end, we will be also bolstering our testing capacity and also set up more temporary testing sites nationwide. And we will also intensify our monitoring of these infections among those young population, and we will also cooperate fully with the metropolitan area to also contain the virus going forward. And starting from the 23rd and 25th of June, we also had a survey for adults on their understanding of the capacity of our quarantine here in the country, and we also have seen a increase by about 8.1% when they said that they will get vaccinated. And also, we also have seen an increase about 10.1% for those who have answered that they will encourage their acquaintances to get the vaccines as well. So we want to thank you once again for your participation in these efforts. And also, we have about 58% of the survey respondents saying that they will comply with the continued social distancing measures. And also most of them said that 2 weeks is the most appropriate time for these continued tightened restrictions. And there were not much people who also answered that they will resume group meetings after these easing of the social distancing measures. And about 11% answered that they will immediately have large gatherings. And about 42% of the respondents answered that it is not yet the point of time to have a large group meeting despite the eased social distancing needs. And to this end, we understand that the larger public is exerting their voluntary efforts to also refrain from having large group gatherings. And once again, we want to extend our deepest appreciation for your participation. And also, we want to thank the many people who are fighting on the forefront against the virus. And to this end, going forward, we will also make sure we have similar the questionnaires going forward as well. And in the quarantine discussion meeting this morning, we discussed the jobs for the senior citizens, and especially these jobs have been tailored for the senior citizens above the age of 65 so that they could return to the job market. And they include also the care services provided at the welfare services. And we believe that a majority of these jobs require people-to-people contact. And to this end, we are also going to give benefits to those who have been vaccinated. And we believe that this can encourage the people to get vaccinated going forward. And also, as for the people who have received at least one dose of the vaccine, we will give incentives for these people by giving them more benefits when they are applying for such tailored jobs. And we will also provide some incentives and allowances so that they could enjoy cultural and sports activities. And we believe that this is also aimed at helping them to also increase their mental health as well, especially given the fact that we have been fighting against the COVID-19 for a very long time. However, we will make sure that we contain and refrain from consumption of food at all times. And as for the details, we will be rolling out them as soon as possible through the local governments. And starting from tomorrow, as you know, we will have the revamped social distancing scheme, which is based on autonomy and a stronger sense of responsibility. And we believe that this is ultimately aimed at returning to our pre-pandemic levels and pre-pandemic routines despite our continued fight against the COVID-19. And this is a guideline that has been devised based on a very thorough and long discussions with panel of experts. And it has not been easy for us to come to a conclusion regarding this social distancing scheme. Even if we have relaxed social distancing schemes, this does not change our fundamental principle of fighting against COVID-19. We need to continue to vaccinate ourselves and also keep social distancing going forward. And it is above all important that you participate in these measures going forward as well. And we ask you to continue to stringently comply with the personal hygiene measures and refrain from having group gatherings. At offices and also other acquaintances, we ask you to refrain from having group meals and please resume them once a majority of the participants have been vaccinated. Together with you, the government will also make sure that we can return to a pre-pandemic routine as soon as possible. Thank you very much.
That was the government briefing on the COVID-19 situation here in the country. South Korea reported 794 new COVID-19 cases on Wednesday. This brings the accumulated number of cases to 156,961. There has been one more death, raising the death toll to 2018. We'll wrap up the coverage here. We'll be back at 12 p.m. Korea time for our midday news with Mark Broom. Bye for now.